All right, so if you joined us last Friday, you saw that we all wore red. The reason: February is National Heart Month, and it was started to raise awareness of heart disease in women. Our health expert, Dr. Kevin Campbell, here this morning with more on that. He's also wearing his red today.
Absolutely. Good to be here.
Yes, good to see you again. How big of a problem is this, Doc?
So we know that women are undertreated and underserved with respect to cardiovascular disease. We know that over 500,000 women will die suddenly from sudden cardiac death each year. Women die from cardiac disease before they die of breast cancer, uterine cancer, or all cancers combined.
The symptoms, I would imagine, in women a little bit different than in men, right?
They are. Women can have classic symptoms like chest pain and shortness of breath and that sort of thing. But women often present with fatigue, generalized feelings of dread, anxiety, just not feeling well, flu-like symptoms, nausea. Very difficult to sort out.
What if you go weeks upon weeks of having something like this? I mean, do you then recommend go to the ER, go to a doctor?
I think it's all about empowering women to understand what their risk for cardiovascular disease is. They need to understand their risk factors: high blood pressure, high cholesterol, family history, diabetes, smoking. If you have these symptoms in the setting of having risk, you really need to engage with your healthcare provider right away.
How are women doing in society today? I mean, you see people day in and day out.
So I think that we have done a remarkable job in the last 10 years of the Go Red campaign, and I appreciate you guys wearing red last Friday. I think that we are making strides, but we're still not there yet. More women than men die of cardiovascular disease every year still, but we're doing a better job.
All right, so I have to ask you, why are you so passionate specifically? I know, this is what you do on a daily basis, but specifically about women. Why are you so passionate about this topic?
As I've mentioned before, my daughter, when she was age 5, was diagnosed with insulin-dependent diabetes.
Right.
We know that diabetes is one of the top risk factors for cardiac disease. I make it my business to make sure that healthcare providers and the public understands that heart disease kills women, so that when I'm not here to advocate for my little girl and for your little girl and for the viewers' little girls, that there's someone there to understand that heart disease kills women.
Well said. All right, Dr. Campbell, good to see you.
Good to see you.
Always look good in red, sir. And of course, if you have a question for Dr. Campbell, it's really easy. Log on to our website, WNCN.com. Search the links we mentioned section. From there, you can find Dr. Campbell's website, or you can like his Facebook page and his Twitter.